Good morning, everybody. Today's Grand Rounds covers a topic that actually impacts, believe it or not, about 1 out of every 4 individuals in this country before the age of retirement. And that condition is called a disability. It's something that many of our patients face, and in fact, it's actually something that many of us are at risk for facing. So it's a very important topic, but unfortunately, in your traditional internal medicine training programs, we don't get a whole lot of information about how to do disability assessments and how to properly advocate for our patients when they do become disabled. Fortunately, today we have Dr. Nabil to teach us about this important topic. Dr. Nabil is an assistant clinical professor in both internal medicine and in occupational medicine. He is board certified in both and also has a master's degree in public health. He actually practices at our Stone Ridge office up in Dublin, and he spends half of his time down at OSU East practicing occupational health. It's his background in occupational health and internal medicine that I think places him in a perfect spot to teach us about this important topic, and I think we're all going to profit tremendously from his discussion today. Please join me in welcoming Dr. Ismail Nabil.
Everybody can hear me well, I guess. Well, thanks for coming. It's a crisp morning. It's going to be frigid. It's going to be icy. It's an impending doom coming. And that's what we're going to talk about, disability, what's happening, how do we determine it. And it seems like a valuable subject, but it has a lot of breadth. So an hour is too short for it. Let's talk about a couple of things. As I walk into my office every morning, there's a stack of papers placed on my desk, and my MA has called me. I've received an email from people, and a patient is waiting to get its paperwork done. And I'm not sure what I'm doing with that stack of paperwork. Those stack of paperwork clearly says disability assessment. I need to make sure that I fill out the form and give it to that patient who's been asking me to do it for a while. But the 4 questions really crossed my mind. How do I determine this patient is disabled or not? What forms do I need to fill out? I have no idea. I never signed up for this. I'm a primary care doc and want to practice primary care medicine. Here it is. I'm filling out the form, and I have no idea what I'm doing. And the last thing of all is she or he is really disabled? So let's start with something that defines it. Let's define impairment. And that's an important part of disability. So impairment is alteration of body functions and structure. And it's not defined in a context of environment. Disability itself is limitation due to impairment. And its inability to function functions of daily living, and it is defined in a context of environment. And I'll explain to you what that means. When we initially thought about disability, really early on in 1960, Nagy presented this model. It's a more linear model where you have an active pathology, and then you become impaired, and after that you have functional limitations, and then in turn you become disabled. And you're unable to physically or mentally engage in activities of daily living. But that's not completely true. We basically disbanded that model pretty quickly because it's such a complex number of things that occurs when disability happens. There are a number of things going on. For example, if the person has osteoarthritis and broken a hip bone, has a hip fracture, it has an impairment, has a condition, then the body function get altered. It alters the activity of a person. He cannot take long walks. He cannot go on and do other things. He can't be engaged in social activities anymore. And he basically spends his time alone in the apartment. There are other environmental factors that also affects that. He lives in a second floor apartment building, and there's personal factors. He's not motivated to work at all. He's 450 pounds to begin with, and now he has a hip fracture and osteoarthritis. It changes everything in a person. So disability itself is not isolated and a linear model, but it's a combination of things that you look for when the person gets disabled. Social Security is an agency that actually determines a patient's disability, and basically they pay you for if the person is off work and unable to perform daily functions. They define as inability to engage in a substantial gainful activity, either determined physically or mental impairment, which end up or can lead to death. Can be expected to lead to death. But there's another part of the definition that basically happens all the time. They also said that if the disability or gainful activity is up to continuous period of 12 months, the person is unable to engage in gainful activity, then he or she will be considered disabled. So let's do a case review. A 63-year-old male came to my office seeking disability evaluation. He's injured at work. He has worked as a project construction manager for Department of Correction for past 35 years. He actually got ejected from his car, hit the windshield, broke the glass of the windshield, and sort of lying on the road, airlifted to the hospital, and actually basically was treated for his injuries. And I'm going to have him speak for himself. So this is a video that I shot right in the office. He gave me
I used to work for Department of Correction, a construction project manager. I'm 63 years old. I got injured in an automobile accident 2.5 years ago.
How are you doing today?
Not too bad. Had to learn how to walk and talk and eat again.
You were in a cast for some time, the neck cast. Now you're able to have good neck movements, right?
The back and neck and the whole cast.
Okay.
But I can move better now after a bunch of therapy.
You've been in a coma after the accident.
Yeah, for 6 weeks.
You were placed on a machine.
Yes, a ventilator and a feed tube in my stomach.
Yeah. You also have shoulder problems. Can you lift up your shoulder? I'm going to ask you to just walk forward as well to see how you do. Okay. Go back as well. Okay. Okay. You have some difficulty with walking?
Yes,
Okay. You still have difficulty with swallowing, right?
yes,
Able to work on your car, and you've been trying to build it.
yes,
Okay. You still have some difficulty with speech.
yes.
Thank you.
So if you look at that person, the question that comes up, the question that comes up all the time is, should I make him disabled or not? Is he disabled at this point or not? We'll decide on that as we go forward. Let's talk about disability process itself. It starts with filing a claim. It takes about 60 to 90 days and can take over a year. Disability determination services are usually assigned, which is state-based agencies, to look into these cases. And the most important thing is they gather information from you. That's where the stack of papers come from on your office. And then medical evaluation is either done by you. They ask you to make an opinion. They request you to make a determination. Or sometimes they send it to people like me who look at those evaluations and make a determination for the agency itself. Disability process itself is pretty complicated and cumbersome. Claims need to be initiated by the applicant. You cannot make the person disabled or tell them that this person is filing for disability. He or she has to make the initial step. They look at the medical evidence, they look at the income eligibility, they also see if the person can work or not. And based on that, the Social Security disability agencies or services basically review the case. And the dismal 32% gets approved initially. And that's where the big bulk comes up. 68% get disapproved, 58% people appeal the process, and then it goes all the way down to Social Security Administration, where the lawyers get involved, and then we see a 58% bump in approval, and then if that case does not get through, then it goes all the way to U.S. District Court. But prior to that, only 2% of the cases gets approved. So it's a very tedious process. It takes about a year or 2 years to determine if the person is disabled or not. So, and it goes through all the paces. Disability evaluation is an important aspect of clinical care. Whether you like it or not, you're part of it. It's a responsibility of the treating physician to really they have the knowledge, they know about their patients, they've been treating them for a long time, so why not? Role of physician is very important in this context. They document the medical finding, they know about the person's impairment, they look at medical history, they synthesize information from different resources. But the problem is, we never had any training to do this. We've been assigned this job without even being asked about it, but we do it on a regular basis to the best of our abilities. There are impediments in rendering those opinions. We have to figure out the clinical information. We have to figure out the non-clinical information. This is not about hypertension only. This is not about diabetes only. This is about the whole function of human being. We have to determine the functionability of the patients. There's legal interpretations of what you do. This will go to court, and you'll be asked upon that the opinion that you rendered is basically have evidence supporting it. There's also financial remuneration. So the reason people are looking for disability is because they don't want to work sometimes, and they just want to get paid for their disability. And there's skills needed for this type of work to really find out the findings that you have and what you're doing about it. And then it's patient's preference as well. He or she doesn't want to become disabled. He or she doesn't want to work anymore. So all these things comes in a bad time because I have only 15 minutes to see my patients and then get it going because I have 18 people on my schedule. All this comes in a place where you are holding a foot down. There's stakeholders in the process that you're doing. The judicial system, federal agencies, state agencies are responsible, and then private insurance companies are also looking for your requests. So regardless of what specialty you belong to, either cancer, or heart, or lung, you will be asked upon to give opinion about disability, and that's an important part of the factor. It's a difficult task to accomplish because there's no formal training that we talked about. There's no formal course that I know of being taught at any medical school or residency. There's a significant amount of paperwork involved, there's lack of time and access, and there's legal implications. But Social Security made it very clear, you're the treating physicians. You need to know about your patients and you have the best perspective. So they are not budging. They're going to continue to ask you that question regardless of what we think as a community, a medical community. We have the best knowledge of medical impairment. We are the best people to assess the impairment in all contexts. But we need to assess the patients in a context of environment, in a daily living status, and also look at the work-related tasks that he or she is doing. Let's talk about the case again. 45-year-old female who's been employed here at OSU Medical Center. She's 20 years veteran and worked as surgical technician. She was diagnosed with carpal tunnel syndromes, also have carpal metacarpal joint tenderness, and decorvans tenosynovitis. So is she disabled or impaired? That's a question that needs to be answered. So just looking at the picture, we can see that she has three things going on in the hand. So as a surgical technician, she cannot work. Basically, at this point, the impairment is causing disability. She's unable to hold down those clamps that she's supposed to during the surgical procedure. What should I do? These conditions need to be treated. Yes, we can go ahead and fix the carpal tunnel. I can inject in the carpal metacarpal joint to help relieve some of the problems. Tenosynovitis, give her some wrist brace, and hopefully by occupational therapy, she'll be doing better than before, and I can get her back into workforce. So she had a period of disability due to impairment, but we can treat that condition and however being accommodated or get back to work. So the clinician task is basically assessing the impairment, impact on daily living, how does it impact work, but not all your work is medically inclusive. It has other ramifications, other things that you have to consider. So let's look at the epidemiology. Where are we as far as disabled nations? In 2010, 300 million people were non-institutionalized population. Those are not in the hospitals. They are ambulatory among ourselves. 18.7% of them, 56 million people reported some level of disability. That's huge. 12.6% says we're completely disabled. They have severe kind of disability. 38 million of us do that. 12.3 million people age 6 and older need assistance and one or more activities. This is a very important number, and I'll show you why. Most of the disabilities are physical disabilities, which is a very interesting thing of looking at, because most of us think that most of the disabilities are mental disabilities, but that's not true as far as census is concerned. We all think about it, but racially it is divided. African Americans, Hispanics claim more disabilities. Rate goes up with age, so the older you are, the more likely that you are disabled. And age 65 and above have high likelihood that you will be considered disabled. So who is the person? A person on the right is disabled, or a person on the left who is disabled? Well, the quick answer, if you said the person on the right, a person on the left is disabled because he's older, he's 80 years old. He is 86 years old, by the way. He's disabled and he doesn't work. You are wrong. The person on the right is, by Social Security definition, is disabled. And if people don't know who the person on the right is Steve Jobs. He's one of the CEO of the Apple, who built the program, one of the iconic person for Apple fanboys. But why he's considered disabled? He actually, at one point, came down and resigned from his position from the board, and also put the resignation letter as a CEO. Tim Cook took his position. He realized his disabilities. He suffered from pancreatic cancer, which finally metastasized, and he died 7 years into it. The person on the left, basically, he's actually his biological father, who he never met, basically. Apparently, in the book, he mentioned that he was in the restaurant and met him once, but never spoke about them ever. They never communicated. He never responded to his email. And he's still works, functions. He runs a restaurant in the West Coast, and alive and well. So defining the impairment, defining disability, how do you define it? Steve Jobs will be considered disabled under Social Security definition, but he never applied for disability. So it's very important for a person to apply for a disability and understand what his disabilities are. Let's talk about disability overall in our nation. The states that are more brown or darker have more disability. So look at the southern state that comes up very prominently. Southern states are more darker compared to northern states. Ohio is a little bit lighter, so we have less disability. Not true. Look closely. Ohio actually has a higher number of people living with disabilities compared to other neighboring states. We actually share this title with Michigan. Wisconsin, Minnesota has higher level of people working in them. Let's look at the disability characteristics. Most people are disabled. They claim that they're disabled because they cannot ambulate. That's most of the people who file for disability. That's the highest trend as far as the estimate. But real number is these. Look at the numbers. They're unemployed. So people with severe disability, 50% of them are unemployed for all 24 months. And only 9.2% people claim disability. This is a pretty recent number. So the impact of disability is huge as far as employment is concerned. Look at the public assistance insurance. They go without public assistance. 50% of about 42.6% people with severe disability have lack of public insurance. They go to the emergency room, they go to the hospital, they don't have coverage, and that impacts us tremendously. Conditions that causes disability are arthritis, back, spine problems, and heart diseases. And increased disability is due to musculoskeletal conditions, a very common factor. I'll show you an MRI that's been taken. This is a person who works at the athletic department here. He was completely disabled because a significant amount of radicular symptoms started. Came to the primary care doctor's office, complained of significant lower back pain with radiation down into the leg. That night has progressive symptoms, taken to the emergency room after that and got microdiscectomy done. And he did very well. He actually went back to work without any significant disability. But here's a similar case, something different. Older woman, 65, fell out of the stool at the DMV office and hit the back, continuous back pain. She also has spondylolisthesis. Basically never recovered. She finally filed for disability and retirement. We do a lot of things to them. We try to make them better. We do transfemoral injections. We take out the disc. We do microdiscectomy, laminectomy, try to help with this lower back pain, go all the way to fuse them sometimes. And the problem is, we have no idea that this is evidence-driven. Sometimes 50% of the cases don't even get better, actually have chronic pain all their lives. But we go ahead and try to cure them or try to treat them. It doesn't happen. So let's talk about the shooting. A scene of a shooting that's happened in 8th Congressional District. It was a crisp Saturday morning, I remember. And Gabrielle Gifford was actually meeting her people at an outside supermarket. And she was brutally shot by a madman right in the head. The interesting story begins a little bit earlier. She's an amazing person as you look into her lives. She's married to an astronaut, Mark Kelly. They have a dream wedding in Arizona. My wife told me that this is a Vera Wang dress, which I don't know what that means. But Kelly summarizes her that she had it all. She has it all. And she gave it all when she was transported out into from the scene of the crime all the way to the hospital. She was airlifted. She was bleeding, as you can see that there's a blood on the head. The person next to her became a hero because he was the one who helped her through the ordeal. She went through intensive care, the hospital stay, and then finally transferred to Houston, where she had extensive rehab done. This is after the injury. You can see a good endotracheal mark in the neck, the picture released after she went through the ordeal. But the interesting thing that really happened here is the way that she was shot. It's a longitudinal hit and not a transverse one. If she would have had a bullet going through her brain, she would have died by now, but because of transverse penetration of bone injury, she actually survived. And she has a remarkable strength in the sense of coming back Saturday, Sunday, Monday, and Tuesday. By Thursday, she was moving both legs. Doctor removed the top of the skull to reduce the inflammation. But an amazing recovery by all means, and here she is smiling. But this is where the real stories start, and it's not done yet. She survived the ordeal, but look at her really trying to say the word light and struggling with it. Road to recovery was never easy. His hair trying to move, trying to shuffle her way forward in the food bank. And here she's taking Pledge of Allegiance, an anniversary after the injury. Gabby realized that she cannot perform the essential function of the job. She's no longer will be able to serve her people, and then she decided that she will resign from the position. But what a force she is. She continues to amaze us. This is Gabby, just recent picture. I've been following her for a long time. And this is an amazing woman who came and spoke for the Sandy Hook victims against gun violence. If you have never seen a video, just open up a YouTube video and then look at her. The resilience continues to be there. An amazing woman by all means. But all brain injuries does not have similar kind of problems. Here's another example of Malala Yousafzai, one of the most shortlisted people for Man of the Year, or Woman of the Year. Time selected her, won by President Obama, but she's the one who actually got shot in the head by a Taliban in Pakistan, in northwest frontier province. The reason for doing that, she's an advocate for women's education. Malala survived the injury, actually airlifted to UK where she was treated for her injuries, and here she's walking out of the recovery room. Difference in how they recover, how they get better is very different for different people. So not all brain injuries are exactly the same as far as recovery is concerned. Social Security disability is basically created in 1954 as a Title II grant. Program was funded by a payroll. Again, payroll tax paid by workers. So less workers, we have no Social Security whatsoever. Social Security is a disability program that's run by a federal government, and 9.7 million people are collecting the checks for disability. There's a grace period before you start getting the checks. The recipient receives the checks as long as there's eligibility requirement. As long as they're disabled, they continue to receive the checks. They turn into Medicare if they're disabled for 2 years or longer. What is the economic impact? Why I'm talking about this and how long it exceeds the expense. We're exceeding the expenditure since 2010. This is a report from heritage.org. By 2049, we are 18.2% of our GDP, and Social Security takes a lot of chunk out of that, which includes other Medicare program, Medicaid program. Obamacare is going to come together as well, and Social Security will be a money drainer here significantly. How are we going to support all disabilities? That is yet to be seen. There's multiple systems, basically. There's Social Security systems, there's workers' compensation system, railroad retirement system, civil service programs, insurance companies. All are looking and asking you questions regarding disability of a person. So that's very important. And so it does not involve only Social Security or disabled patients, but also workers who have applied for short-term disabilities. Let's talk about the case. Social Security disability case, a 45-year-old male with severe cardiomyopathy, ejection fraction of 25%, unable to perform heavy workload, also have metastatic cancer. Social Security is looking for medical evidence for this patient to have medical impairment. We have determined it through echocardiography. We know his cardiac status. They're also looking for disabilities as far as what he can do at home, and is it interfering with ADL or activities of daily living. They've categorized these things in 14 broad categories. If you have time or intent, or you can't sleep at night, you can certainly read that blue book that's been published online. They're also looking for residual functional capacity. They want to know about how long a person can sit, stand, walk an 8-hour shift, and able to make decisions for him or her. Let's do another case review. A 50-year-old male with myocardial infarction, atrial fibrillation. The question is he really disabled or not? He works as a fireman, so people who are saying that he's not completely disabled really question that inference here. This is the amount of work these guys do. You have to be a highly motivated person to run in the building that's burning and bring that person out of the building which has smoke and fire, and you are really walking into a death trap. The amount of gear that they carry, the amount of work they required, a person with atrial fibrillation or myocardial infarction in the past, it will be a very hard time to justify. And dying on the job is not what the employer wants. So that person will be essentially disabled, regardless of what his impairment is, to do this kind of job. Work-related disabilities are very common. There are in manufacturing, in construction, natural resources, and in health services as well. There's another system that we talked about a little bit. I'm going to briefly summarize that. It's a whole new topic to go into, is workers' compensation. It's different from Social Security disability. It takes into account three things. It takes into account temporary total disability, permanent partial disability, and permanent total disability. Just to give you an example of what temporary total disability is, a female getting pregnant is she's considered disabled to work, but that's a temporary condition, so we label it as temporary total disability. And that's how we basically go through the process. Workers' compensation is a no-fault system. It also look at relatedness of work and the injury, and contact dermatitis due to chemical agents could be considered as work-related, but there's no separate diagnostic test that I can really tease out that this is caused by work and this is caused by primary condition, and things get muddier as we go forward. Let's review another case. 45-year-old with extensive rotator cuff injury. He's employed as a housekeeping staff at the local hospital here. He works about 6 hours a day. He's doing light duty. And is he considered disabled? Well, when he came to see me, he has significant osteoarthritis of the right shoulder. You can see a significant arthritic joint up here. So this is his primary condition, but because he got injured at work, I have to deal with the osteoarthritis and the injury that he had. He has a massive rotator cuff that you can see up here. Two orthopedic surgeons went in and tried to fix his rotator cuff injury. Remarkable recovery this man has done. He's able to lift, abduct, rotate his shoulder very well, and he was sent back to work full duty without restrictions. So we do this on a regular basis and try to reduce the cost itself associated with these cases. There are a number of disability assessment tools that on your disposal. There's knowledge, medical knowledge of the medical condition, knowledge of job or workplace environment. You need to know that and assess individual specific abilities. Their general function assessment questionnaires are there. These are validated questionnaires, and they're pain assessment questionnaires. There's lower back questionnaires. Westry disability questionnaire, if nobody has seen it, this is how it looks like. It looks at pain intensity. It looks at personal care, sleeping, even sex life. I need to ask all these questions to really understand how the lower back is contributing to the disability itself. And then there's functional capacity evaluations. So God help us, those physical therapists are really unique to us. They help us in making this determination really well. Functional capacity evaluations are systemic, they're comprehensive, objective, and they're done by physical therapists. So let's show you sort of a couple of simple videos to really help you gauge. Music is just behind in the background, but some will enjoy it. This is waist to overhead test done in the physical therapy office. This person's really lifting and then putting it all the way up top. Gives me a lot of assessment in the sense how he's doing. He's lifting a small weight, pulling it up, lifting it and placing it back. I'm looking at the shoulder, I'm looking at the back, I'm looking at upper back, I'm looking at how he's fixing, he's moving his legs. All these things are beneficial in sort of addressing the basic need of what this person can do or not. As we go forward, we tend to increase the weight and basically also check for heart rate, and that's been changing. Carrie Souza, who you just saw, is the one who actually helped me with the video in these slides. So going forward, I'm going to show you another video which is actually looked at carrying capacity. And that's another way of determining what the person can do. So here we are doing is, person is walking forward, lifting a heavy tote or basket, and coming back. So alignment, how he's doing with the weights, a significant amount of weight he's carrying, and then going back all the way and putting it back. I cannot simulate real life, but I can get close to it. I know what he or she can do. A person with significant osteoarthritis, knee complaints, a person with significant lower back pain, upper back pain will not be able to perform these jaw functions very effectively. And that's what we're looking at. That's what we really want to see, if this person can do that jaw functions or not. And again, then the weight gets bigger. He's actually putting his weight down. He's holding his ground as he lifts up the things, basically. Let's go on to the next one. This is another simple test, which is a floor to waist exercise. You guys can do it on your in the clinic. And this is again a heavy basket full of weights. He's lifting. He's actually putting his foot down, planting himself well, lifting it up, placing it back. Simple test that gives me enough information about lower back, knees, shoulders, neck sprain, neck muscle itself, and technique itself. And these are really important assessments that you can do really in the office to really assess in 8-hour shift how he's going to do this, how he's going to figure out what to do, and that's what Social Security also wants you to address in those forms. Okay, going forward, and so we tried everything. We make sure that this person is able to function, work, do other things, but somehow, somewhere, the impairment becomes permanent. Those loss of body functions does not go away. They are there forever. And there where this person cannot work, cannot function. And so what we do is we assess the percentage of disability or percentage of impairment based on whole body functions. And we have some guidance on that. American Medical Association publishes a guide of permanent impairment, and that's available to all physicians who can do this. And it rates the impairment. It rates the amount of impairment or dysfunction the person has. In Ohio, we use AMA Guide 5th. That's been used in other 13 states. The newer guide is American Medical Association Impairment Guide is 6th, and it's used by federal claims. We in Ohio don't use the 6th guide. All these cases goes to court. There's a back and forth negotiation on these impairments. Employer insurance agencies end up paying on these impairments. So this is a big deal and happens all the time. At the end, I'm just going to emphasize on I believe in you, I guess, and I think you have a role in disability determination. You, as a clinician, are at the best position to understand and help your patients in getting disability or not getting disability. You need to determine medical impairment. You need to be objective. You need to assess it well. You need to make sure that you're doing a right thing. Be honest to yourself and the patient as well. You need to assess their daily living. You need to figure out the ways to understand how the person functions at work, how the person functions at home, an important part. And you're the one who has the medical judgment, disability tools, and functional capacity evaluations. God bless those physical therapists. We can determine person's disability. Thank you so much. Thanks for being here in the crisp morning, and I'm open to questions.